Yes, ma'am.
All right, I'm going to provide privacy. Hello. How are you doing today?
I'm doing good. How are you?
I'm doing fine. Thank you for asking. All right, so my name is Raven. I'm a student nurse. I go to Albany State University. Okay. So what we're going to do today is I'm going to take your vitals and I'm going to do your health assessment. Okay?
Yes, ma'am. Congratulations.
Thank you. I appreciate it. All right. So before I begin, can you tell me your first and last name?
Yes, Coco Hammond. That's C-O, C-O. Last name is Hammond.
All right, great. What's your date of birth?
My date of birth is 4/9/1969. That's 04/09/16. Excuse me, 1969.
Okay. Do you know what today is?
Yes. Today's date is Sunday, September the 29th, 2024.
All right. And do you know where you are?
Mm-hmm.
Where you are?
At home.
Okay. All right. So you are A&O times 4. All right. So before I begin, do I have your consent to do your vitals and do your health assessment?
Yes, ma'am. You sure do.
All right. So what I'm going to do first is I'm going to go ahead and wash my hands. All right. Do you have any questions before I begin?
No, ma'am. I'll ask as I go if I see need to be.
All right. So what I want you to do is I'm going to take your blood pressure first.
Okay.
All right. Which one do you normally get your blood pressure taken in?
Well, I think the left. Well, it could be the left is normally where I get it taken.
All right. And also, before I begin, do you prefer for me to call you Coco or Miss Hannah?
Oh, Coco is fine.
All right. Good. So, what I want you to do is pull your arm out for me. Okay. I'm going to place it up here. Alright, so what I'm doing is I am placing this above your brachial artery. It's not too tight, is it?
No, ma'am.
Alright. So, I'm going to hold this. Right here. Alright, so the cuff is going to feel tight. I'm going to puff up the cuff. It's going to feel a little bit tight. And as I release, I'm going to be able to hear your pulse, and then afterwards, that is going to be your blood pressure. And I'll let you know what your blood pressure is.
Okay.
All right.
I'm just trying to relax. Make sure it ain't too high today.
Okay. All right. I want you to relax for me.
Yes, ma'am.
You okay?
I am.
All right. All right. So I've got 138 over 70, which is great.
That's awesome.
Mm-hmm.
I walked this morning now. I walked for about 2 hours. Praise God. Look at God. Won't He do it? Thank you, Lord.
It's at 138 over 7, correct?
That is correct, ma'am.
All right. Okay. That's great that you exercise.
As long as I can keep living.
Okay.
Thank you, Jesus.
Okay. Alright, what I'm going to do next is I am going to check your pulse.
Yes, ma'am.
Alright, I want you to relax for me.
All right.
Alright, and start by my watch. Pulse. Okay. So I have your respirations as 20, which is still good. And then I have your pulse at I have it at 70.
So what's the range?
So for pulse, the range depending on where you are, but for the most part, it's 60 to 100.
Oh, okay. So mine is 70.
Mm-hmm.
Okay.
And then your respirations are 20.
And what's that? What's the range for that?
10 to 20.
Oh, okay. I'm at 20.
Yeah, so between 10, 12 to 20. So,
Ooh.
which is good. It's still fine. Yes, your breathing is normal, is equal. Also, I didn't hear any as far as I didn't see any labored breathing.
Mm-hmm.
Your breathing was how can you say it? It was non-labored.
Which is?
Meaning you're not breathing heavy for air compensation.
Okay.
Mm-hmm. So there we go. That one. Okay.
So there's nothing to be concerned with.
No.
Okay.
Okay. So what I want to look at next is I'm going to look at your eyes, your nose, your mouth, and your ears. Okay. And then afterwards we're going to do the visual acuity test. So I'm going to do this, and this. But we'll get to that momentarily. All right. So what I'm going to do is cut the light off. Alright, we're going to simulate like it's dark.
Okay.
Alright. So I just want you to look straight ahead. Look straight at that wall for me, okay? Alright, pupils are reacted to light. Pull your bottom eyelid down for me. Look up. Alright, good. Alright, you can let go. Alright. Look in your ears for any infection or drainage. Okay. Look in the other ear. Okay, good. Alright, I want you to pull the tip of your nose up. Alright, moving your nose for any drainage. Infection. Good. Alright. I don't have a tongue to press, but I do want you to open your mouth up for me. Okay? All right, open up a little bit wider. So I'm looking at your teeth. I'm looking at your mucosa. With the tongue up to the roof of your mouth. Good. And then say ah.
Ah.
All right. So I don't see any infection, any drainage, any bruising. All right, good. So what I'm going to do next is I'm going to assess skin turd, meaning this assess if you're dehydrated or not. So if the skin pulls back quickly, that means you're adequately hydrated. If it, what we call tinted, if it just stays there for a long period of time before it goes back, that means an indication of that you might be dehydrated. So pull your skin here. That means you're adequately hydrated. Okay?
Mm-hmm.
Now, what I want you to do, I want you to tilt your head back a little further. All right. I'm gonna look at your thyroid. I want you to swallow for me. Good. All right. So I don't see any asymmetry. I don't see any goiters. All right. I want you to touch that forward. All right. Good. So next, what I'm going to do next is I'm going to feel for your lymph nodes. All right. So I'm going to go from right here, right here, right here, right here to right here. A lot of people say it feels like a neck massage. So
I'll let you know.
All right. You ready?
Mm-hmm.
All right. So I'm going from right here. Feeling pain and discomfort?
Mm-mm.
Alright, good. I don't feel any swelling, any distension of the lymph nodes. Alright, and patient denies any pain or tenderness. Alright, so what I'm going to do next is I'm going to look at your arms. Alright. I'm looking at arms for any bruising, discoloration. Turn over. Good. Alright, do this for me. Okay, do that. Alright. Alright, put your hand down. Alright, do that for me. Alright. For, like I said, normally when I do this, I'm looking for any needle marks, any bruising, discoloration. Alright, let me see your arms. Alright, I'm going to feel for your brachial artery. And this is where I took the blood pressure in, okay?
Mm-hmm.
Alright, let me see this one. Alright, brachial arteries +2. Alright, so this right here, this is your radial artery. Mm-hmm. So I'm going to feel for both of these. Okay, and then I'm going to assess if the quality and the depth of both your pulses. Okay?
Mm-hmm.
Alright. Relax for me. There we go. Alright. +2 for radial artery. Hold your fingers out for me. Alright, I'm going to assess for capillary refill. Although you do have nail polish on, I can still assess for your capillary refill from the tips of your fingers. So basically when I press your finger pads, it's going to go red. So it takes about 2 to 3 seconds for the blood to reach back to your finger pads. As I said, it's a little bit difficult because you have nail polish. Okay. You feeling the pain and discomfort?
No.
Alright. Although it is not required, I'm so used to doing this. Alright. I want you to, if you can, have a way to deadweight your legs for me. So you might need to swoop back some. Alright. Relax your legs for me. Kind of come a little bit. There you go. Sometimes I get it, sometimes I don't. I see you have reflexes. Yep. You have any pain?
No, not today.
Okay. Alright. Next one. Yep. Saw it. Alright, so you have reflexes.
Please stop.
Okay. So next what I'm going to do is I am going to take a look at your feet. Assess the skin. Check for any edema, meaning swelling. Also, I'm going to feel for your pedal pulses. So basically, you have pulses in your feet.
Oh, really?
Yes, you do.
Okay.
Alright, so what I'm doing, I'm assessing the skin, make sure there's no bruising, no discoloration. You said that you had knee pain, not today, but
I had injured my hamstring, which I thought was creating me pain. But when I went to the orthopedic doctor, he said that it was the pain from my hamstring that was injured, and it's been over. It took a year for it to heal because I really pulled that muscle. So I had to take it very easy, light duty, nothing too strenuous on my knee. So some days I get knee pain, but if I walk, it helps with my back and my knees. So that's why I do a lot of walking to alleviate the pain from my lower back, my knee.
alright, do you take anything for it?
Occasionally I may take ibuprofen for the inflammation, but I don't do it that often.
Okay. Okay. So you said walking helps relieve it, and then so you had to rehabilitate for over a year?
I did. I had to go to physical therapy 3 times a week for 6 weeks.
When was that?
Oh, actually, it was this year.
Okay.
I had to go from January to March, I think, or December, November to December to March, I think, something like that.
So last year.
Yeah.
Okay. All right. Anything else? Any recent procedures or surgeries?
Oh, no surgeries here lately. No. I just try to take care of myself. I know I need to lose some weight. So I've been exercising. I don't, kind of cut back on my diet. So I feel better with that. I fast about 16 hours a day. So I just limit my meal taking to 1 meal. So I feel good with that. So that has helped with putting all that food within my system.
All right. So what I'm gonna do next is I'm gonna check for these pedal pulses. All right. So the right is 2, and then
What that mean too?
that means it's we normally don't say normal, but it means that the pulses are normal as far as depth and quality. Now sometimes everyone thinks that it might be bad. It's not bad. Sometimes people's pulses might be a little faint, but for the most part, your right leg is 2 and your left is 1, which is not bad.
Yeah, The left was one I had all the issues with.
Mm-hmm.
My left side, that's why I injured my hamstring, my knee pain, and all that.
Mm-hmm.
So it's building itself up. The right side is a little stronger than the left side.
Mm-hmm. Yeah. I want to make sure I fill it in before I make that determination. Okay. I'll close it now. So 2. Alright. So skin is warm. Alright. For temperature, technically you don't have a thermometer, but we're gonna say 98.6. Okay. Alright, got your blood pressure down. Equal. Alright. So we got regular. So 20. Alright, so 9. Alright, so you haven't been on oxygen or anything like that before. Alright.
No.
Alright. 9. Alright. See. Alright. So what I'm going to do next is I'm going to listen to your lungs and to your heart. So I'm going to kind of move from right here to right here to kind of like right in here, right in here. Okay, and then I'll listen to your heart. So right here and right here, and then I'm going to ask you to lift your breast up, and then we'll listen to this part of the heart, which is the apical pulse, for a full minute.
Okay. A whole minute.
A whole minute, I know. Alright. Alright. So the reason why I'm listening to your lungs is just to make sure that they're clear, meaning I don't hear any wheezing, any crackles, any rails, any what we call adventitious sounds. Okay. So I'm gonna listen to the front and then I'm listen to the back. Okay. I'll let you know when I listen to the back. Okay.
Yes, ma'am.
All right. All right. Turn your neck that way for me. There you go. All right. Deep breath in. Let go. Deep breath in. Let go. Deep breath in. Let go. Alright. Kind of go up in here. Deep breath in. Let go. Alright. Deep breath. Let go. There's a certain particular order that listen to the lungs in, but deep breath. Okay. Alright, so now I'm going to listen to your heart. Okay, you ready? You're going to touch your skin. So just breathe normal for me, okay? Alright, what I want you to do is lift your left breast up. Okay, so I'm going to kind of go underneath here, okay? Let's see. There we go. Just breathe normal for me, alright? Alright, I'm gonna wait till it go on my time. You feeling okay? Alright. Alright. I got your apical pulse as 72.
Is that good or bad? What that is?
That is good. So the apical pulse is basically we call it the apex of the heart.
Mm-hmm.
So it is at the, I think it's the fifth intercostal space.